Hello and welcome to Radio Zindagi 1170 AM. I'm RJ Vijaya. So, as we continue to hunker down and shelter in place during the coronavirus crisis, we have to take care of our physical, mental, emotional, spiritual health. But just as important is our dental health and our oral hygiene. And that's because at this time, we really don't have access to our regular dentist whom we could run up to if something goes wrong. So the onus is really on us to take care of our dental health to the T till we tide out this crisis. So, how do we nip those problems in the bud and really avoid them from escalating? Well, I have just the person to share with us all of the advice, all of the guidance you need to take care of your oral health. And I'm so happy to have Dr. Gauri Bhagwat join us. She is, of course, a practicing family and cosmetic dentist, and her approach to dental care is totally proactive and preventative. And not just that, she's also a teaching faculty at the prestigious UCSF School of Dentistry. So she's wearing two hats today. She's bringing her professional and her professorial input to this conversation. So I'm so happy to have her. Hello, Dr. Gauri. So nice to have you on the show.
Hi Vijaya, thank you so much for having me on and for giving me this opportunity to give some information to our listeners and viewers.
Yes, very well needed, and you're doing such a great community service by really, sharing with us because tooth care is underrated, but it's most essential. When the tooth starts hurting, all hell breaks loose. So you got so you got to do that. So now with the shelter in place, all of our regular routines and schedules have really gone out the window. But a new routine has set in, and that is of grazing continuously and chomping all through the day, and all unhealthy foods most of the time, junk foods, sugary foods and drinks, and that is certainly doing a number on the teeth, not to mention the waistline, but that is another show. So we restrict ourselves to the tooth problems, and most people land up with cavities, which are very common. So how do these cavities really form, and what can we do to really nip that cavity in the bud?
I'm so glad you asked me, Vijaya. Cavities is probably the number one thing damaging people's teeth. And a cavity really is just a hole in the tooth.
Mm-hmm.
Now, most of us, we don't know this, but our mouths are literally germ factories. We have millions and millions, probably billions of bacteria growing in our mouths,
Mm-hmm.
different strains of bacteria. Some bacteria are more active in causing gum disease. Some are more active in causing cavities. Now, the cavity-causing bacteria, cavities happen basically because cavity-causing bacteria in the mouth use leftover food on the teeth. And sweet stuff, simple sugars, are the easiest for them to use.
Mm-hmm.
But they will use any fermentable carbohydrates. So that's most of our food: dal, chawal, roti, sabzi, milk, fruits, everything. They use this leftover food on our teeth and they produce acids.
Mm-hmm.
Those acids are literally dissolving and destroying our enamel, softening spots on our teeth.
Mm-hmm.
And those soft spots eventually become a hole, and that's a cavity.
Wow.
So that's basically what a cavity is.
Mm-hmm.
And some simple things that will, in the long run, really help save your teeth.
Mm-hmm.
The basic thing, you want to cut down on bacteria levels in your mouth. You want to cut down on leftover food in the mouth.
Right.
You want to bring down the acid in the mouth.
Mm-hmm.
So the most important thing, every time you eat something, anything other than water, the leftover food, the bacteria will use it. They will produce acids. And what we have found is every time you eat, if you don't brush or rinse right away,
Mm-hmm.
your mouth remains acidic for 1 whole hour at least.
Wow.
It takes 1 hour for
Mm-hmm.
your saliva to wash away the acid
Mm-hmm.
every time you eat. So people who tend to, and especially now, because like you said, the new
Yes.
routine, people are sitting at home at their desk working, and they're snacking on on all kinds of stuff through the day.
Yes.
Um, Unfortunately, a lot of it not very healthy stuff. So,
Mm-hmm. Mm-hmm.
right now, people, if they are snacking frequently, there is
Mm-hmm.
going to be acid building up on the teeth
Mm-hmm.
pretty much all the time. And so, some simple things that you can do: cut down on the frequency of snacking.
Oh.
So, try to eat, whatever you want to snack, try to eat it in one go. Don't do it, because if you eat it, if you eat often, there's acid building up every time,
Mm-hmm.
which is very, very bad for cavities. So try to eat it in one go. Reduce the frequency of snacking.
Mm-hmm.
Every time you eat anything, eat or drink anything other than plain water, try to rinse out your mouth. Ideally, brush. If you cannot brush, at least rinse out your mouth. And
Mm-hmm.
say you're in an important meeting, you can't really get up and rinse. Keep a glass of water at your desk. When you eat something, take a big sip, swish it around, rinse it around in your mouth, and you can drink it. That food was going to your stomach anyway.
Mm-hmm.
But you don't want to leave it sitting on the teeth
Teeth.
for those bacteria to use.
Mm-hmm. Right.
So, another very, very important thing, in the pharmacy, you will get a medicated mouth rinse. And it will say, so I'm not talking about your regular Crest or Listerine.
Mm-hmm.
This is a medicated mouth rinse, and it will say there's different brands. Two of the good brands, one is called ACT, ACT,
Mm-hmm.
another is called Phosphor, PHOSFLUR.
Mm-hmm.
It will say anti-cavity rinse or fluoride rinse. Now, the way these medicated rinses work, they help to reharden the enamel. And that's how they help to prevent cavities. They help to slow down existing cavities. So, especially in this time when dental care is not as readily available,
Yes.
that is an excellent preventative. And you can rinse out with them once a day. Just make sure you're spitting everything out. And children can use this as well.
Yeah. And
It's
you're
safe.
killing two birds with one stone. You're getting a little bit of fluoride and you're taking care of your teeth. So what could be better, right? And of
Exactly.
course, while you're talking about this, I can't think of anything more damaging than the soda that people keep guzzling. A lot of people addicted to soda, even more so now in this situation. And that's your pet peeve, I know.
It is. It is. Oh my goodness. All my patients, they hear this every time they come in, so they know. Soda is literally one of the worst things that you can have for your teeth.
Yeah.
It has acid, so it's
Hmm.
like straight putting acid on your teeth. It's close in terms of acidity, it's actually close to battery acid. You wouldn't drink the
My
acid,
gosh.
would you?
Yeah. I'm sure you're scaring off a lot of people now, hopefully.
It is very, very acidic.
Mm.
In addition, the non-diet sodas also contain sugar. So it's a double whammy, Not to say all the preservatives and whatnot in it is not too good for you as well,
Mhm.
but the acid and the sugar is really bad for your teeth. So some things, and this is actually, soda is the worst, but other acidic things, lemon water, orange juice, wine, these are all very acidic. So with all of these, you want to minimize the contact with your teeth. So soda, of course, try to drink as little as you can.
Mhm.
When you do drink it with a straw.
Oh.
And what that will do is it will reduce the contact of the soda with the teeth.
Mhm.
So drink it with a straw. Anything acidic, you want to drink it up as quickly as you can. Drink it with a straw whenever you can. Now, one important thing, do not brush right after you have something really acidic like this. Because what happens is when you have something like soda, it kind of softens the enamel because it's so acidic.
Mhm.
And then if you go and brush hard right away, you can wear the enamel away faster.
Wow.
So rinse out with water or drink water. So get the acid off the teeth,
Mm.
but then brush after about 20 minutes or so.
Excellent, excellent. So, if folks, you're just joining us, we're talking to Dr. Gauri Bhagwat, and she is, of course, a practicing family and cosmetic dentist right here in the Bay Area, and also teaching faculty at prestigious UCSF school. She's joining us to give us tips on how to take care of our teeth during this time under in lockdown, and to avoid basically leading to bigger problems teeth-wise. So. Dr. Gauri, any other problems that really come to the fore at this time? Cavities was one.
So
Mm-hmm.
cavities is a big one. Another big one is gum disease. And people often think, oh, it's just, my gums here. And signs of gum disease is, bad breath or bleeding from the gums when you brush or floss or eat
Mm-hmm.
something hard. Now, what people don't realize is the bacteria that are causing the gum disease. So the bacteria from the gums actually enter your bloodstream. And
Wow.
we found now there is very, very strong research that shows that gum disease raises your risk and increases the likelihood of heart disease, diabetes, stroke, heart attacks. And in the last few years, we found it raises the risk also of Alzheimer's. And in pregnant women, it increases the chance of early, so preterm labor and delivery and small birth weight babies.
Wow, that's
To the point
incredible. Mm-hmm.
Yes, to the point where researchers have actually found fragments of oral bacteria in the brains of people with Alzheimer's.
Oh my gosh.
So we know without a doubt that they enter the bloodstream and they are literally damaging your whole body. So
Mm-hmm.
you've probably heard of the gut microbiome
Yeah.
and how the bacteria in our gut affects our health. Well,
Mm-hmm.
the oral microbiome, same thing. We are just starting to find out how the oral microbiome affects our whole body, damages our whole body. So you can just, Google search terms like gum bacteria, general health, search terms like that. You will find a ton of information.
Mm-hmm.
So really,
Incredible. Yeah.
really, yes, really important to give equal emphasis to the gums and gum health. And, you know, so at home, what a lot of people will see at this point is, they may see some bleeding from the gum.
Mm-hmm. Mm-hmm.
That's a sign that there is bacteria building up there. Now, the best thing to do, I do recommend using an electric toothbrush 2 times a day. Use it for a minimum of 2 minutes. So you should be brushing for a minimum of 2 minutes, 2 times a day. The
But
area
people feel the bleeding gums, they don't want to brush and hurt that area.
no, so the bleeding is not going to hurt the gums, but the bleeding is a sign that there is bacteria there, and the
Mm-hmm.
bacteria will hurt the gums. So areas where the bacteria tends to build up, right where the tooth meets the gum. So right at the edge of the gum. You
Mm-hmm.
oftentimes you will see this sticky whitish yellowish film there.
Mm-hmm.
And that is actually a biofilm called plaque. It's made of millions of bacteria. And you need to scrub that off. So
Mm-hmm.
electric toothbrush, 2 minutes, 2 times a day. Very, very important. Make sure you're brushing all the way down to the edge of the tooth, right where
Mm-hmm.
it meets the gum. And
Yeah.
when that sticky yellowish film, make sure you've cleaned it all off.
Mm-hmm.
Also, very important, even the best brushes cannot get in between the teeth, where two teeth meet.
Mm-hmm.
So you want to make sure you're either using floss or you get these little brushes in the pharmacy. They're called interdental brushes. They clean in between two teeth. You can use those or you can use a water flosser like a water pick. But very, very important to be using something to clean in between the teeth, at least once a day.
Also, do you need to massage the gums as well
You
with your
could.
fingers?
You could. Certainly, if there are areas that are sore or bleeding, massaging will help.
Mm-hmm.
But that actual scrubbing with the toothbrush
Is
and
what is
in between is what is really going to make
important.
the big difference.
Wow, that's like jaw-dropping information right here. I mean, who knew that gum disease has such wide-ranging ramifications on overall health, right? One would never have thought that.
Unfortunately, it's not commonly known, and I feel like in my profession, dentists need to do a better job of explaining this to their patients.
Very
So,
true.
really important. And then the other important thing, not
Mm.
many people know, but a big cause of tooth loss also is cracks and fractures in the teeth.
Whoa.
With some people, yes, they may be actually grinding their teeth at night, and
Mm.
this is strongly related to stress, which, in the Bay Area, we all we have more
Yeah.
stress
Yes.
than, than other areas sometimes. So night
Gritting their teeth all through the,
Night grinding is one thing.
yeah.
Then a lot of people, when they're focusing and concentrating or exercising, they have a habit of pressing their teeth together. And we call that clenching the teeth. So it's like teeth pressed together. And
Mm-hmm.
both of those are very, very damaging. It's a
Mm-hmm.
big cause of fractures. And your dentist at every exam should be monitoring for signs of that. And there are treatments. There are, teeth guards and stuff that can be made for you.
Mm-hmm.
In addition, certain kinds of food you want to be careful with. So a big cause of fractures is actually crushing ice cubes.
Oh.
So
Mm-hmm.
a lot of people like to
Interesting.
do that. It's actually very bad for your teeth. So, if you do like ice, go for the small little crystals of crushed ice, but
Mm-hmm.
do not crunch down on big ice cubes. Another big one is unpopped popcorn kernels. So, if you're enjoying a bag of popcorn, as you're getting to the bottom of the bag and there's more of those unpopped
Yes.
kernels, be really careful. Those are very, very known for cracking teeth.
Mm-hmm.
So you want to be careful of that. I always tell my patients, your teeth are fine instruments. They're not heavy tools. So
Mm. Wow.
treat them with care.
Right. So people need to be so mindful of what you're putting in the mouth, the quality
Yes,
and
yes. And
what
with
it
our
does.
Indian food,
Y-
we eat a lot of like lentils and stuff, which are very good.
y-
But you
Yes.
want to make sure that they're well soaked and soft,
Yeah.
because often like small stones in the lentils,
Mm-hmm.
or lentils that haven't softened and stuff.
Yeah.
Those also can be bad for cracking the teeth.
Mm-hmm. Very great information right here. And so I was curious, how are you seeing patients at this time? What is urgent, what is non-urgent, and how do you really advise patients?
So yeah, so it's important to follow the state directives to save lives and flatten the curve. And so my office and most offices, pretty much all offices in the Bay Area, we are rescheduling non-urgent appointments. But I want to make sure that I am accessible to my patients
Mm-hmm. Mm-hmm.
for any help they need. And so currently what I'm doing is I'm having all my calls from my office phone forwarded to my home phone and my cell phone. So if patients have any issues, then they just call the office. They reach me right away.
Mm-hmm.
I do a lot of phone consultations, and we do a lot of virtual and teleconsultations. And people don't know this, but actually insurances have approved teleconsultations for dentistry during
Mm-hmm.
the COVID pandemic. So, first I will consult with the patient over the phone. And then if need be, we will go ahead and do a virtual consultation over, forums like Zoom or FaceTime. Um, and that's really important because for dentistry, small issues, if they are not taken care of in
Yes.
a timely fashion, they go on to big problems. And
Mm-hmm.
so, all dentists really should be doing a lot of virtual consultations. They should be available to their patients. And
Absolutely.
I just wanted to put it out there, for our viewers and listeners. I am available if you need any dental help. Vijaya, you can share the office phone
Yes,
number.
absolutely. So a stitch in time saves nine, like they say. So it's better that you get onto it if you feel something's not quite right. Dr. Bhagwat is there to help you. You can call her at 408-725-0335. That's 408-725-0335. Or you can send her an email at gbhagwatdds@gmail.com. gbhagwatdds@gmail.com. So really great insights right here. And right, I feel like a lot of people, right, even right now as they're listening and watching this, they're experiencing issues like sensitive teeth and bleeding gums and swelling in the gums. So are these sort of symptomatic of something bigger, and what can you do to really resolve it at home if you can?
So I would say some of the most common issues that I see people facing at this point: sensitivity in the teeth, bleeding from the gums, and sometimes swelling or pain in the gums,
Mm-hmm.
and pain in the teeth. Now, sensitivity in the teeth typically is because of two reasons,
Yeah.
most of them. One is there could be a cavity in the tooth.
Mm-hmm.
And that is typically, when you have something sweet or cold, you have this sudden sharp feeling in the tooth. That's
Yeah.
sensitive. So that one reason could be a cavity. Another reason could be if the tooth has a long root that anchors it in the jawbone. If
Mm-hmm.
the gum level that's covering the tooth, if the gum is going down and that root is starting to get exposed, that can be very sensitive.
Wow.
Now, if it's a cavity, then once things are back up and running. So first of all, any issues that you're having, any symptoms, you should connect with your dentist or with a dentist, and I'm happy to help if needed. You should connect with the dentist and run it by them, do a virtual consult if needed. um, as long as it is not anything major, most things can be dealt with over the phone. But for example, in my office, if I have a patient with a true serious emergency, I
Mm-hmm.
will go to the office and help them even during this time.
Yeah.
But
And a lot of
please,
people are missing their 6 monthly checkups as well,
yes,
right?
yes,
When they do the cleaning, when the doctor's able to figure out something's wrong, they're not having that right now too.
we're not having it. So a lot of early issues are being missed. And so, getting back to sensitivity. So if there's a cavity,
Mm-hmm.
you will need to get it treated, but first speak to a dentist about it. Um, you want to do all of the preventative things I mentioned for cavities. So if there
Yes.
is a cavity, it will help to, especially the fluoride rinse and keeping
Mm-hmm.
it will help to slow the cavity down so that it doesn't get bigger too much while we are waiting for things to normalize.
Mm-hmm.
That's one.
Mm-hmm.
Secondly, if it is sensitivity because of the gum going down and the root being exposed, there is a toothpaste called Sensodyne that you will get in the pharmacy. It is meant for sensitivity. Try brushing with that, see if
Mm-hmm.
that's helping. If that's not enough, if you see that, okay, it's an area right at the edge of the gum that is sensitive, you could, before you go to bed, take a teeny little smidge of the Sensodyne, just rub it on that area that's sensitive.
Mm-hmm.
Spit out the excess Sensodyne and then go to bed. And try this for a couple of days, and that should help with the sensitivity.
I see.
Now, the next common thing I see or hear is bleeding gums. And bleeding gums, as I mentioned before, it's a sign typically of bacteria building up there. So for that, ignore, and this seems counterintuitive, but ignore the bleeding. The bleeding is not going to hurt the gum or your body.
Mm-hmm.
The bacteria there will. So ignore the bleeding, brush and floss really well. You could do warm saltwater rinses a couple of times a day, and you could also massage that bleeding area with warm salt water.
Mm-hmm.
But brushing, flossing the spot really well, and then in 2 to 3 days, it should reduce. Now, if it doesn't, there is a prescription mouth rinse, which your dentist or any dentist can call in a prescription for you over the phone.
Mm-hmm.
That prescription mouth rinse is a very strong antibacterial. It will bring the bleeding down right away typically.
I see.
So important to contact your dentist. Some things that really shouldn't wait. So
Yeah, I mean, I'm wondering when is a good time to just grin and bear it, and when is it important to just get to that doctor or the
so
emergency
what
or wherever.
I say is any symptoms, connect with your dentist, make sure it's something minor.
Mm-hmm.
And then if it's one of these things that I mentioned, typically you can manage it with home remedies.
Yes.
Sometimes people will see a swelling in the gum. Now, as long as it is just a small swelling only in the gum, you can
Mm-hmm.
try massaging it with the warm salt water. Sometimes, if needed, your dentist can call in an antibiotic for you to bring that down. Usually, it's a sign of a local infection.
Mm-hmm.
A local infection is not as much of a risk, but sometimes the local infection can become an infection that is spreading. And that is a very serious issue. It can be life threatening.
Wow.
So, signs of a spreading infection. If there is swelling on the outside of your face, if you look in the mirror and you can see my cheek is swollen and I can see it from the outside,
Mm-hmm.
or my area here is swollen, the area under my jaw is swollen, those are very severe, very serious infections. You need to get in touch with the dentist immediately. You may need to go to the ER.
Mm-hmm. Mm-hmm.
Other signs of spreading infection. If you have a toothache and you start to have earache associated with it, if you have a toothache and you start to have a fever,
Mm-hmm.
you have toothache and you start to have difficulty breathing, that's a sign that the infection is spreading around your windpipe and it can be life threatening. So,
Wow.
all of those
Mm-hmm.
difficulty breathing, fever, or earache associated with a toothache, or a swelling that you can see on the outside of your face,
Mm-hmm.
all of those are extremely severe. You need to get to it right away. Get help right away. Do
Mm-hmm.
not wait. It
Mm-hmm.
can be life threatening.
Wow, you've really laid it out threadbare, and I so appreciate all of your insights and input. It's really great to do that. And so, on another note, gloves and masks are now our new normal, and we can't go anywhere without it. But people don't realize that they're not really using it the right way, and there is a degree of cross contamination that can happen with not using it right. So shed some light on that. I know that's another of your pet peeves, and you've observed that so well among the people these days.
And I'm so glad you asked me that. And thank you for giving me the opportunity for getting this out there, because I'm telling you, I see this in the grocery store every time I go in. And there's times when, like, I actually feel like marching up to people and telling them, do not do this. And my husband sometimes is like literally physically restraining me in the grocery store saying, you cannot do this here. So, okay, so And this is, it's not people's fault, because
Yeah.
this is really, you need to have a medically trained mindset for this.
Mindset.
It's
Mm-hmm.
drilled into us. And I drill this into my students at UCSF and my staff in my office all the time.
Mm-hmm.
The thing is, you need to kind of keep in mind the concept of clean versus contaminated. Okay. Now your hands are clean. When you put them into gloves,
Mm.
and then you're touching things in the store with those gloves on, you're assuming that there are germs on objects in the store. The virus may be on objects in the store. When you touch it with your gloves on, the outside of your glove, you want to assume it is covered with virus. The way I teach my staff and my students is, when you have gloves on, imagine that those gloves are covered with blood and germs. Okay. So you want to keep in mind anything that is clean. So, in the grocery store, for example, I go in and I see all the time people have gloves on, they've been touching things in the store, and then they adjust their hair with it. They
Mm-hmm.
adjust their mask, their glasses, they hold their handbag. They go into their handbag or pocket with that glove on, which now has germs from all over the store. And they go in and they pull out their cell phone, they pull out their wallet. Well, what is happening is, you have to assume that that glove is covered with germs. And like I said, in a medical setting, we tell students, assume it is covered in blood.
Mm-hmm.
Okay. If you touch your hair, your glasses, your mask, your phone, your wallet, your clothes, you are now transferring those germs and blood to all of that. You've now contaminated all of that.
Oh my gosh.
Now the danger is, when you then go home, you take off your gloves, you wash your hands, and you think, okay, now I'm all clean.
Mm.
But the problem is, you then go and touch that cell phone, which probably has germs because you
Yeah.
touched it with your glove. Now that cell phone has germs, you're touching it with your now clean hand.
Mm.
Now again, your clean hand has germs on it. And
Mm-hmm.
then you may go and, you may hug your kids, you may touch things in your house. Now those germs are in your house.
Gosh, that really puts it into perspective. How many of us, identify with that? We do this all the
I
time.
see this on TV all the time. I see this in the grocery stores, and I'm just going, no, don't do that. Seriously. So what you want to do? Suppose you're you're in the store, and
Mm-hmm.
you have gloves on both hands.
Yeah.
Okay? And suppose you're getting an urgent call, you need to answer it.
Mm-hmm.
With one gloved hand, hold the fingertips of the glove in the other hand, and holding the fingertips, pull it off. And you've got your hand out. Now your hand is clean.
Mm-hmm.
Now with this clean hand, it's fine to go in and touch your phone, your wallet, your hair, whatever you need to touch. Okay? Put it back away. And then if you need to touch something in the store again, put either that glove, or you can throw it and use a new glove, whatever. But if you need to reuse the same glove, you want to make sure that when you put it on, you do not touch the outside of it.
Mm.
Like kind of, hold it up and kind of thread your hand into the inside. It's
Mm-hmm.
better if you just throw it away
Throw it.
and use a new glove.
Use. Mm-hmm.
But if not, but definitely you don't want to use those gloves that have germs from all over the store to touch things on yourself, things in your bag, you know.
Yeah.
So, and it's hard, it needs a lot of training and that kind of mindset to do
Mm-hmm.
it. But at least I'm hoping that if people are aware of this problem, they will be more mindful of it.
Mm-hmm.
So thank you.
No, thank you. I mean, we can't thank you enough. You've really, it's been eye-opening, and people must be taking away so much from this conversation. Everything from, what's happening with the teeth and such far-reaching implications, and then the gloves as well, which now we can't get away from, and it's like part of our very being, as it were. So, folks, if you've enjoyed what you've listened to, we've been talking to Dr. Gauri Bhagwat, and she's a family and cosmetic dentist. And you can see, and she also teaches at UCSF's dental school. So you can see how lovely it was to talk to her, and really came away enriched. I never knew talking about teeth could be so interesting, but there it was. So you can reach out to her during this time. 408-725-0335. 408-725-0335 is her number. And Dr. Bhagwat, thank you really for this. Is a great community service you've done, and you don't know
No,
how great it's been and how many people you've reached. Thank you so much.
no, thank you, Vijaya. This was a really great idea. It's something that's been on my mind. So much of needed and preventative care is being missed at this point. So thank you for giving me the opportunity to maybe help people. And just a word to our viewers and listeners,
Yes.
if you have any questions, any concerns, do not hesitate.
Hmm.
A stitch in time really saves nine where the
Yes.
teeth are concerned. And so reach out to your dentist. If you have a hard time contacting your dentist, you can reach out to me. I am happy to help. But do not think, oh, this is probably okay. It's better to ask an unneeded question 100 times. That's what I always tell my patients.
Hmm.
Bother me 100 times. It's fine. I would rather answer 100 unneeded questions than to miss the one needed,
Question.
needed issue. So
Absolutely. So
your
there's no silly question right here.
there is, yes, no silly or weird question. Ask away. Reach out when you need help.
Hmm. Thank you. Thank you from the bottom of my heart. And thank you, ladies and gentlemen, for listening. Hope you've enjoyed and taken away valuable insights. And until we meet next time, you keep listening to Radio Zindagi. Jiye ja.
Stay safe, everyone.